This video is the property of Hill Oral Surgery. Any distribution is prohibited. Hi, I'm Dr. Marcus Hill. Thank you for taking the time to watch this consent video on wisdom tooth removal. And thank you for trusting me with your care. Wisdom teeth do not frequently have enough room to erupt properly into your mouth and be properly cleaned. Most of the time they cause more harm than they do good. If your dentist recommended that they be removed, then I'm happy to help. Your wisdom teeth will be removed under IV sedation. When you come in, we'll start an IV in your arm, give you medications through it that make you relaxed and sleepy to where you don't care what's going on. And when you look back, you're very unlikely to remember anything that happened. You'll be deeply sedated, but it's still very safe because you're still breathing on your own, your blood pressure's maintained, you're not intubated, you're just checked out. The lights are on, nobody's home. While you're sedated, you'll get all the same numbing medicine as if you were fully awake. So when you wake up, there should not be any pain. The pain will slowly increase as the numbing medication wears off. You'll want to take a non-steroidal anti-inflammatory drug like ibuprofen if you're able to take it as soon as you get home. We'll also prescribe a mild narcotic for you to take only if you need it. I recommend you take the narcotic a half tab at a time. You can always take the other half an hour later if the pain is intolerable. The pain does get worse over the first few days and then slowly begins to resolve. To minimize the pain and swelling, I recommend that you ice your face on both sides for most of the day of surgery as well as the day after. This helps prevent the pain and swelling. You're going to get the chipmunk cheeks. They usually peak around day 3 and then slowly get better. Don't be alarmed if it's asymmetric. Most of the swelling and pain usually comes from the lower teeth, and it varies with the level of impaction. Impacted wisdom teeth present a special set of risks. Most of these are temporary inconveniences. There is a nerve that runs through your lower jaw and gives you feeling in your lip and chin. Across the board with wisdom teeth, there's a 10% risk of that nerve being bruised. However, only a 1% risk that it's permanent. There's also a nerve that goes to your tongue. This is even less likely to be damaged and again is usually temporary. Both of these nerves will be numb for most of the day of surgery. This is from the numbing medication. The upper teeth are near the sinus cavity, and there's often only an eggshell-thin piece of bone between the tooth and the sinus cavity. If there is any hole in this and you blow your nose, you could blow bacteria from the sinus into the healing socket and cheek. Air passage can delay the healing, cause an infection, and take weeks to resolve, may even require an additional procedure. And although the risk of serious sinus complications is low, if we warn you about your sinus, try to avoid blowing your nose for at least the first week following surgery. If you have sinus irritation, over-the-counter sinus decongestants are recommended. You can also use saline spray that you spray into your nose and gently inhale. But try to avoid blowing your nose out. The most common complications, though, are bleeding and infection. If you don't have bleeding problems and you're not on blood thinners, this risk is really low. Day of surgery, just bite down on the gauze, follow the post-op instructions, and that's unlikely to be a big issue. Infection, however, though, is a legitimate risk. I recommend that you start the prescription strength mouth rinse and the antibiotic that I write for the day before the surgery and continue them for the week afterwards to minimize the risk. Another complication is root fracture. If a small piece of the root breaks off, we may choose to leave it behind. This is unlikely to be a big issue. If we leave it behind, it will likely stay put. If it ever does come to the surface, it is unlikely to be a big issue. Removing it would cause additional risk of pain, swelling, and possible damage to the structures around the area. In order to get your wisdom teeth out, we will likely split them into pieces prior to removal. This allows us to make a smaller hole so you heal up faster. Don't be alarmed if somewhere in your sedated state you hear a drill. This is normal and to be expected. I place sutures in most sites to help you heal faster. They are unnecessary and will not be replaced when they fall out, no matter how soon. The sutures dissolve on their own, and there is nothing you need to do with them. Don't pay them any attention. Please read through the detailed consent form you were just given. The paper consent, rather than this video, is the actual consent. You may also visit my website, hilloralsurgery.com, for more information about me and to watch this video again. On the day of surgery, there are 2 important things that you must do. First, have nothing to eat or drink for 8 hours prior to the surgery. This includes water, nothing to eat or drink the morning of surgery. Second, you'll need a driver to come with you, stay with you the whole time, take you home afterwards, and take care of you after the surgery. Now, I look forward to meeting you on the day of surgery. Don't be nervous. This is so much easier and safer than you imagine it to be. Thank you for your time and trust. Have a good day.